Whenever you are exercising, doctor, there is a forced respiratory outburst. What is it because of? It is because of ventral respiratory group. Doctor, regulation of respiration. Top 50 topics in the 600-hour हमारा program में physiology में respiratory regulation every exam AIMS PG कभी भी जाओ NEET PG one question आएगा examiner पूछेगा आपको क्योंकि you're all the future experts, right, doc? So let us get straight about this. You have a pons, you have a medulla that control the breathing. In the pons, you have a pneumotaxic center and a apneustic center called the pontine respiratory group. Medulla mein, you have a ventral respiratory group VRG, dorsal respiratory group DRG. In turn, they will control the accessory respiratory muscles, internal intercostal muscles, external intercostal muscles and diaphragm. So this is the typical structure. So where do you have pneumotaxic apneustic center? Pons. And where do you have ventral dorsal respiratory group? In the medulla. By इन चीजों के बारे में एक दो पॉइंट्स हम डिस्कस करेंगे. I am very happy to see almost 60 online students. Today evening, every Thursday evening, doctor, there will be a free session next to 25 Thursdays that will make us to revise all the 2019 question papers, 2019 and 2018 question papers. Now, doctor, ventral respiratory group कहाँ रहता है? फटाफट बोलो, medulla में रहेगा. इसका काम क्या है? They will lead to voluntary forced expiration and that will lead to increased forced inspiration. So you are planning to propose love and your girl is getting into the elevator in medical college. तो बहुत prepare हुआ. Oh darling, I love you so much. I am kneel and heel for you. Your breathing will increase, right? So that is all your ventral respiratory group. Then what is your dorsal respiratory group? Where is it located? Medulla. So it is the one, it controls the inspiratory movements and the timing of these inspiratory movements. That is important. Swimming is all about control of the breath now. Your dorsal respiratory group is very important. Medulla. Then all our ventilatory rate mainly dependent on what? Partial pressure of the carbon dioxide is a very important determinant. And we have the chemoreceptors and they are the ones which sense the changes in the pH. Whenever you are hypoventilating, your PCO2 levels increase and that lead to development of carbon dioxide becoming carbonic acid, releasing the H plus ion and leading to respiratory acidosis. If you are hyperventilating, your CO2 leaves your body and that lead to respiratory alkalosis. Those changes are the ones which are sensed by your chemoreceptors. Now, doctor, if you look at the pons has two important respiratory control centers. What are they? Apneustic and pneumotaxic center. Pehla, apneustic center of the pons, what does it do? If you are taking long breath, deep breath, so long and deep breaths, it sends the signals for inspiration. When you are taking long and deep breath, then intensity of breathing. आप कितना intensity योगा कर रहे हैं, आप कपाल भाता कर रहे हैं, so intensity of breathing is by the apneustic center. And now doctor, what makes the apneustic center to get inhibited? Suppose you have intensely breathed, that makes your lungs to expand. You can't blow out, no? Like the airbags in the car accident. So that expanded lung stretches will make the apneustic center become inhibited. और apneustic center को एक boss है, वो है pneumotaxic. Pneumotaxic center also inhibits the apneustic center. So ultimately आपका apneustic center काम करे तो क्या हो जाएगा? आप long deep breath intensely ले लेगा, and that is the reason functioning of the apneustic center will increase the tidal volume. What will you remember? It will increase the tidal volume. Functioning of the pneumotaxic center will inhibit the apneustic center. इसलिए what should it do? Decrease the tidal volume. That is a function of pneumotaxic center. So now 3-4 points, let us talk about pneumotaxic center. Many times we discuss this, but since it is asked in the PG Medical 2019, it is in the hit list of the examiner. You have to go back to the online MBBS video library and take a chance to do a more detailed review and also solve many more MCQs based on this. The pneumotaxic center, it inhibits the inspiration. And it finely controls the respiratory rate. If the pneumotaxic center hukum diye to, immediately phrenic nerve become inhibited. Phrenic nerve suppress diaphragm. Similarly, pneumotaxic center नाराज हो गया तो apneustic center become inhibited. So ultimately, pneumotaxic center will make tidal volume to decrease is what you need to ultimately remember. So that is the story, doctor. Be very sure. Good to see 55 online students. You can click on the YouTube icon and that will land you in the chat window. You can start chatting the answers, those who newly joined today. Now doctor, functional residual capacity. What is the meaning of it? It is the volume of the air which remains in the lung after normal expiration. You can do forced expiration or normal expiration or after normal expiration. So जब आप normal expiration, inspiration करें तो उसको क्या बोलते हैं? Tidal volume. So normal expiration करने के बाद भी whatever the air remains in the lung, इसको कहते हैं FRC. Once more, doctor. All these lung volumes, spirometry, examiner one question, definitely he will ask. So please do revision. It is one of our 50 hit list topics. Tomorrow I will try to give you release the PDF of the 120 days, 600 hours, 1000 topics list that you are going to revise on the onlinemmbbs.com video library. Now doc, antegrade relaxation of the intestine during peristalsis is because of which substance? GIT hormones is a hit list topic. Whenever one part of the gut is contracting, other part of the gut need to relax to facilitate. Who is responsible? It is the vasoactive intestinal peptide. So if you look at the various GIT hormones, you have a gastrin cholecystokinin family. You have gastrin and cholecystokinin. Secretin family, secretin, glucagon, VIP and GIP, gastric inhibitory peptide. Then you have a somatostatin family, motilin family, substance P. That is how you divide all the GI hormones. So if you look at the vasoactive intestinal polypeptide, it leads to smooth muscle relaxation of the lower esophageal sphincter, stomach, gallbladder, everywhere. It stimulates the secretion of the water into the pancreatic juice and the bile, and it causes the inhibition of the gastric acid secretion, and it inhibits the absorption from the intestinal lumen. That's the reason if you have too much of VIP, then the intestinal luminal absorption becomes diminished and all that fluid remains in the gut and lost as diarrhea. So that's called vipoma, VIPoma. When the VIP excessively is produced, that lead to diarrhea, right? So that is VIPoma. Now doctor, which has the slowest conduction of the nerve impulse? Once more, nerve fiber classification is a hit list topic among the 50 topics. Postganglionic sympathetic fiber. So what is the classification of the nerve fibers, doctor? You have class A, class B, class C. A and B are myelinated. That's the reason conduction is fast. So A has A alpha, beta, gamma and delta. A alpha has somatic motor and proprioception. Proprioception, you have muscle spindle में 1A and Golgi tendon organ में 1B and 2. 1B, not 2. 2 is A beta. So touch and pressure is 2. Gamma, it is efferent, that is going and supplying the muscle spindles. Then you have the delta, which is the cold, touch and pain, fast pain. So there is also a numerical system called 1A, 1B, 2, 3 and 4. That and ABC system. World is very unreasonable. You have to mug both the sides. But one thing you need to remember is preganglionic sympathetic fibers are all myelinated, fast conduction, whereas postganglionic sympathetic are the type C fibers and slow conduction. Examiner exactly want that. Postganglionic sympathetic has the slowest conduction is what you need to emphatically answer. Now, good to see Alexeth, Abdul Majid, Roshan, Satya Snigdha, etc. etc. Good, good, good. So, doctor, corpus luteum after ovulation क्या करेगा? Ovulation physiology is another hit list topic in physiology, 50 topics. So FSH and LH stimulate the follicle to make it a maturing follicle that releases the ovum with the LH surge. LH in turn stimulates the corpus luteum and that produces the progesterone predominantly plus estradiol post-ovulatory from the corpus luteum. With the old age, what are the physiological changes? Easy question to answer. There are 4 core characteristics of the pulmonary aging. As you become old, there is a reduction in the muscular mass and power of your respiratory muscles. Pulmonary compliance decreases. That's what you need to, it increases the pulmonary compliance. There is a reduction in diffusing capacity. And there is a decline in the control of the breathing is what you have to ultimately remember. Is there anything difficult in this? physiology except 1 to 2 Yorkers. Most are predictable. Oh, hypoxia wala question only is thoda examiner is trying to check your patience. In type 1 diabetes, what is true? Always remember, insulin is a lipogenic hormone. Lack of insulin is the lipolytic state. So type 1 diabetes where there is no insulin, there is an increased lipolysis. That is what you need to remember. So normally insulin inhibits lipolysis. Hence there is a decreased acetyl-CoA, decreased pyruvate carboxylase, and there is a decreased glucose production. If the insulin is there, why your sugar is in control? Because liver will decrease the glucose production and release into plasma. If there is no insulin, there is an increased lipolysis. What is the end product of the beta oxidation of fatty acids? Acetyl-CoA. So that increases the acetyl-CoA, pyruvate carboxylase activity, and increased glucose 3-phosphate and increased glucose production and release into plasma. Hence we get the hyperglycemia in case of type 2 diabetes or any diabetes when there is insulin is not there. Now, which protein is not produced by the liver? Common sense. 8th class bachcha bhi bolega ki bhai immunoglobulin is the job of the plasma cell, not liver. So albumin, alpha fetoprotein 2, 7, 9, 10 among the coagulation factors 2, 5, 7, 9, 10. Out of them 2, 7, 9, 10 are vitamin K dependent. 2, 5, 7, 9, 10 are produced in the liver. Be very sure. हम बहुत teasing करते हैं हमारे classmates को reading room में. बोला रे, what are the liver produced? What are the vitamin K dependent? 2, 7, 9, 10 are vitamin K dependent. 2, 5, 7, 9, 10 are liver produced. That is what you should remember. Fibrinogen, haptoglobin, prothrombin, antithrombin 3, then thyroxine and steroid binding globulin, apolipoproteins, transferrin, ceruloplasmin, angiotensinogen. This is a favorite question. Angiotensinogen is produced in the liver. 25-year-old, alcoholic male, dyspnea, bilateral pedal edema, मतलब congestive heart failure में है. अगर अल्कोहल पिए तो विटामिन थायमीन का डेफिशिएंसी हो जाएगा. That's the reason whenever a thiamine deficiency guy, I mean any alcoholic is there, just don't give hypoglycemia. Treat करने के लिए only glucose नको देना, glucose के साथ thiamine भी देना. So it is a classical case of wet beriberi, where you have congestive heart failure, peripheral neuritis, etc., etc. Which amino acid do you need for norepinephrine to epinephrine? Recently we discussed catecholamine, pheochromocytoma. See, these are the topics which are the common things in multiple books. Biochemistry में norepinephrine epinephrine आएगा, फार्माकोलॉजी में भी आएगा, जनरल मेडिसिन में कैटेकोलामाइन, फियोक्रोमोसाइटोमा में भी आएगा. 3 जगह में भी अगर आप अज्ञानी रहे तो भगवान भी हेल्प नहीं कर पाएगा. So that is the reason mercilessly you should prepare, audaciously you should prepare. You should prepare only to be the winner, right? And basic फंडा जो concepts रहता ना डॉक्टर, उसमें you should not be shaky. You are, if you are Dr. Murali's student. So doctor, Sam is a good guy. Sam is S-adenosyl methionine, and it is a methyl donor. Where do you need methyl donation of methyl group? Typically, creatine production में you require methylation reaction. Sam will donate the methyl group. And when norepinephrine become epinephrine, S-adenosyl methionine become S-adenosyl homocysteine and donates the methyl group. So it is the methionine of the SAM which makes norepinephrine to become epinephrine is what you should remember.